question was more about what are the opportunities for subspecialty procedures like MIGS? And I know you spoke a little bit about it, but perhaps you can talk perhaps a little bit more about that, but also about the feedback that you get, perhaps with the reps there, and also with the faculty, sort of how that works to, you know, impact your experience.
Sure. So I think it depends a little bit on how much you want to get out of it and what you want to see and what kind of initiative you take in that regard. On our senior rotation, we do and are expected to do a lot of MIGS. So it is just a good thing to prepare ahead of time so that way you can make the most of your OR experience. I didn't plan this. I mean, you can get like your little Zen, you can get practice lenses. I have a whole box of Belts that I just emailed the company and they mailed to my house. So it depends on what you want. And I'm sure if I was going the retina route, or you could have more catered experiences. I think my experiences with the reps so far have been that they send your cell phone, they'll meet you whenever you want, they'll bring whatever tools, because they're looking to get a customer for life and you're getting tools and experience in return. And I think most of the reps are very familiar with Mass Eye and Ear. They come in and out all the time. They also work with attendings, and like when new techniques come in, they are there in the background to help troubleshoot issues, even for attendings using things for the first time. And I think in terms of one-on-ones with attendings, again, I think it's what you want to get out of it. So if you take the initiative to say to an attending, can we make, you know, after clinic, would there be, you know, some time to go and practice this technique? I think all attendings that I've worked with would try to find a way to have at least some time to go over that.
Question particularly asks about the new PGY1 intern class that will soon be integrated into the ophthalmology residencies. And the question is whether they will be part of this wet lab program, or what do we envision perhaps for them as part of our surgical curriculum?
Yeah, thanks. So yes, overall, we really believe that simulation is the foundation of surgical training, and we are very lucky, as has been described tonight, to have the resources to provide that simulation. And there's no reason that learning those skills shouldn't happen from day one. So our PGY residents who will be at Newton Wellesley Hospital will rotate with us for 3 months out of the year. So that means they will at least be with us for 3 I&I sessions, and we will involve them in those. And in addition, they will have one-on-one or small group sessions when they are rotating with us, to most likely with the chief resident, but perhaps with other faculty members. I think one of the big advantages of having this integrated format now is not only that we'll get to clinically start teaching our residents earlier, but we'll also start to build surgical skills earlier. And if you can build and start the foundations in your PGY 1 year, that even means you're off and running even more so in your PGY 2 and beyond. So we're very excited to extend this into that first year of training.
Question is whether or not there's cutting edge technology on the horizon at Mass Eye and Ear that we foresee to incorporate into improving patient care. So if there's some sort of innovative surgical procedure or new technology or new technique that someone wants to speak about relating to surgery.
Something that's really exciting that we get to participate in during our retina rotation is actually using the 3D heads-up Ingenuity system. I think that's really changed a lot of the teaching experience, because the residents get to have the same view as the fellows, the attendings. It's also beneficial for the surgical techs in the room. So I think that's been something exciting. We also use intraoperative OCT here, which is on the forefront of imaging technology in intraoperative use. And so I think getting exposure to all of the cutting edge technology, because our attendings, we have so many attendings here, we get exposed to all different types of surgery. I think we get a really well-rounded experience, and we're always exposed to up and coming technology.
Fantastic. And then the last question here is asking about opportunities on courses for refractive surgery and new transplant procedures. So I know that's definitely incorporated in the I&I.
Absolutely. So our I&I session on corneal transplants is very useful because, first of all, there's not that many PKs being done anymore. Surgery is moving much more towards DSAC, DMAC, even DWAC. And our residents get to participate in all forms of corneal transplant in the ORs, most significantly as senior residents on the cornea rotation. So I think we prepare them well in the wet lab, and then they get to participate in the ORs as a result.